Laproscopic surgery is one of the later additions to abdominal surgery. It has been around for more than 2 decades now, and this has revolutionized the treatment of many conditions to the extent that there are certain conditions in which surgical treatment has gained popularity only because it could be done through laparoscopy. The most common examples being gallbladder operations, weight loss operations. It would be very difficult for a patient to get convinced to undergo a weight loss procedure if it involved a big cut on his tummy. The advent of laparoscopic procedures for this has encouraged a lot of patients to go ahead for weight loss surgery, to go ahead for reflux operations, to go ahead for gallbladder surgeries only because the surgery involves no cut and it is done through a keyhole. What is laparoscopic surgery? As the name invites, what is laparoscopic surgery? Laparoscopic surgery is a technique wherein the same procedure which is done with hand instruments by opening the abdomen is performed by the use of small keyholes and with the help of a camera which magnifies the internal organ, and the entire operation is done by looking at a screen with laparoscopic instruments. Though it involves a different type of skill sets than what is needed for an open operation, large amount of technical expertise and skill advancement has happened in the last decade to the extent that majority or if not most of the gastrointestinal operations these days are performed laparoscopically. The main advantage is the magnification which the surgeon gets during the operation. It is as if he is seeing each and every structure sitting very close to them. The second advantage is it's very easy for the surgeon to teach his colleagues and juniors who can observe the monitor and learn the procedure. It also helps surgeons to add new and new procedures to their armamentarium when they go out for training. From the patient point of view, the advantage is enormous. There is no cut or a very small cuts involved in. The patient advantage is also enormous. The patients avoid a large scar on the abdomen. The pain involved with laparoscopy is significantly lesser than what is involved in open operation. The return to work is very fast. Risk of future development of hernia in a scar is also minimized. Risk of future complications like intestines getting stuck, which we call as adhesions, are also minimized in laparoscopic operations. Laparoscopic procedures are here to stay, and that has been the stepping stone to the next generation of treatment modality, namely the robotic operations, which is actually an evolution of laparoscopic surgery with much more finesse and advancement.